You're listening to The Morning Show.
8:30 the time already. This day has just flown by, no doubt about it. But let's hope it slows down a little bit here so we can get all the good stuff that's happening at HSHS St. Anthony Memorial Hospital. And we got Theresa Rutherford with us today. How are you doing, young lady?
I'm great. How are you?
Pretty good. Hey, pull that. Oh, you're good. I'll just turn you up a little bit. We're good. We're all good.
There.
Okay.
We're learning this new room as we come along here, and she's here to tell us what's happening at the hospital.
You know, we've got a few things going on. Our colleagues are working really hard, and we're moving forward. We just completed an echocardiography certification, and we, of course, got our ILPEX award, which is Illinois Performance Excellence. So we continue, like all great businesses, to work to continuously improve ourselves. And the staff have come on board with that, and we're meeting our promises to the community, really paying attention to our core values of respect, care, competence, and joy. And also working on a few things that will be obvious to the community itself. We're working on the design right now of our new and expanded emergency room, so improving that to meet the better needs of our community.
Do you know how long it's been since the ER has changed? I mean, you haven't
It's
been
a
that
long time.
That's what
I'm
I
not
was
that
thinking.
old.
Mm-hmm. Yeah, it's been a long time.
We actually had a state-of-the-art ER at the time it was built. Mm-hmm. But now we really want the privacy for people. We want them to have private rooms. We want to be able to have good line of sight so that the staff can always be in contact with them and give them the space they need to do the treatments that they need. So that's what our community tells us, and that's what we're going to deliver.
That's awesome.
So we're excited about that.
Good.
Nice idea. I like the fact that you've been branching out as far as incorporating more student participation. I've had a chance to meet some of the kids from Liberty University at various venues, and that's been a welcome addition.
Well, you know, we're about halfway through our first year of students from Liberty, so we have 10 of them, and I cannot say thank you enough to the community and to our physicians because they have really embraced them being here, and the community has done a great job of making them feel welcome. And Dr. Jennings and I were just down at Liberty doing a recruitment fair for next year because the next year of students will be coming. And last year this was our first year, so we had a few students talk to us, but most people didn't really know where Effingham was. Mm-hmm. Now, based on the experience that they've been getting in the community, people are standing in line to come to Effingham because they recognize what a great experience they can get with their health care. So I understand you're going to talk to them this afternoon at 12:30 or something like that.
So that should be awesome.
Yeah.
So my son will be in at 12:30. He's one of the med students.
Is that right?
I'll brag on him a minute.
Very nice. Nothing wrong with that.
Yeah.
Theresa, where is the university at?
It's in Lynchburg, Virginia.
Okay.
And they have a beautiful campus there and a great facility, but it's a smaller community and they don't have enough space in the medical community right there locally. So they have campuses in Texas and in Carolina, also here in Illinois, so other places, so that the students can get the best experience. Our students are thrilled because they are one-on-one with a doctor.
Oh, very nice.
And so they get to be a part of everything that physician is doing as long as it's okay with the patient that they're caring for.
Okay.
So, again,
Nice.
thanks to the community because they've been truly amazing in welcoming them here.
You know, when the Workman Sports and Wellness Complex opened, one of the key ingredients was that the hospital leased space out there. And so I have friends and family both that work out there.
That's right.
I think it's worked out pretty well.
It's been a great thing. It's increased our visibility. So as people come and go, if they're healthy, they see it as well. But it also gives us a public place where we can do our outpatient therapy, and having access to the pools has been amazing.
Oh, I bet.
I was off for some surgery this summer and got to watch some of the therapy that was going on in the pools. So both older people, but also young children, that the water was calming and supporting to their joints and to their therapy. And so it's been a great addition that we weren't able to provide at the hospital itself. So that's been a super good expansion. We're looking forward to the playground this summer as we do our early childhood intervention therapy. They'll be able to use the playground this summer as well, and so that's another addition. So
Very
again,
nice.
how do you make things more normal while you're continuing to expand therapy and be supportive of what our patients need.
And it's cool that everybody was adaptable. I know originally the hospital carved out some times in the pool, and then later on they said, we don't want everybody looking at us while we're doing it. So now they just go when everybody else goes, and it's worked out really well.
They do their thing, and
Yeah.
the people can still, whoever's, enjoying out there.
Well,
can
we're
go out and
lucky
swim too,
because
yeah.
the facility is large enough that you can, carve out your little bit of space, but yet it still allows the community to continue to do their work out at the same time. So I think it's been good for all of us.
And you have a great convenient care facility there on Temple, right across immediately to the west from the hospital proper.
That's correct. We started with some shorter hours, and we were having patients wait and be there earlier trying to see providers. So we expanded our hours recently, so we're open 365 days of the year, and our convenient care is open from 10 a.m. to 8 p.m. So I think that's really been dramatic, and we've been seeing, as unfortunately the flu's picking up, we've been seeing more people need that service. Again, we want them to use their primary care provider if they have a physician, but if they can't get in to see their doctor and they don't need to see an emergency room physician, then convenient care is a good answer for that.
A nice next step
It
in there,
really
just
is.
for
That's right.
in case you need that.
That's right.
Any other expansions coming up at the hospital? You got lots of things happening.
Well, we're getting ready to break ground on our ambulatory care center, which is a big physician building, which will house some of the new physicians that we're attempting to recruit at this point in time. So again, meeting the needs of the community, and we needed space to put them. So that gives them a space that's close, but also gives them lab and radiology and some of the diagnostic services right there in the building. So it's convenient, again, for our patients. We're also getting ready to share some space with Dr. Opilka at his new Altamont clinic. We'll be providing the support services there. So again, patients can come in to see him and in one-stop shop get the other services that they might need. So we're excited about that as well.
And I saw him at the gym the other night. And one more thing, be sure if you see Dr. Opilka, ask him about his kids playing hockey.
That's right.
Yeah.
Always.
Yeah, be sure to ask about that.
Oh, you probably won't have to ask.
That'd be a good conversation.
But again, we're all part of families, and it's about our health care and other things that we're doing in the community. When you think about the hospital, this last year we hired 100 new people to our team.
Holy cow.
In calendar year 16, and we continue to look at how do we expand in services like home health. We're in 27 counties for home health, and we had just a few weeks ago we broke 1,000 people on roster for home health.
Oh, my goodness.
That's all the way from here to St. Louis, and that's all done with our colleagues from St. Anthony's, and so we're thrilled with that growth and being able to meet that need. Because it's all about how do we become part of a community. And, we've been part of the Effingham community for well over 140 years, and we've been very blessed by that. And the community has done great things to support us, and we want to continue to give back to the community as well. So with our workforce, the IHA, the Illinois Hospital Association, does an annual review and says, okay, this is what your contribution is. So our financial contribution back to the community on a year is about $235 million of money that's put back in due to construction, like we talked about, or just a large employee base putting their money back into the community where they live and work. So we're very blessed to be able to be part of that, and we can't thank the community enough for that support, because it's about us mutually supporting each other, assessing what we need, and then growing to meet those needs. So we're very excited about that. We also last year gave back to the community a little over $9 million in community benefit. And so that's things about our Christian care, about people who might not be able to at that point in their life afford their care, but allows us to make sure that they get good health care. So again, it's that idea of a mutual respect, giving back to the community that we are so fortunate to live and be part of. So again, we can't say thank you enough.
In case folks don't know, St. Anthony's is the largest employer in Effingham.
That's right.
That's correct. Again, we're very blessed for that. Maybe someday healthcare will be at a point where we won't need to be that big. But right now, we continue to move from an inpatient to an outpatient sort of an environment. That's the part of our business that's growing. So again, how do we make it convenient for you so that you can get your treatment earlier and not maybe need to be admitted to the hospital? Because again, we're about the health of our community, not about the illness in our community. So we, again, continue to expand and treat that.
A lot of cool stuff, a lot of preventive things. Walk with a Doc comes to mind,
Oh,
but
yeah.
just a lot of ways that you reach out in addition to health care, but that preventive
Well,
thought.
and again, that's a great reason to be part of Effingham. You know, now that when it's warm, we do Walk with the Doc out at the Trek Trail, and to have that available to all of us every day, regardless if we're doing Walk with the Doc or not, is a great reason to live and work in Effingham. So we appreciate that as well. The other thing we've been trying to do is I appreciate you having us on today. We do this about this time every year to talk about what we've been doing, but also we want the community to take the opportunity to ask any questions that they have. They can go on to our website. They can send questions to my email address at teresa.rutherford@hshs.org, or they can go on to our HSHS website, and there's an Ask Teresa button on there.
Very
And
nice.
you
Make it
can
easy for them.
open that up and ask questions as well, and then one of us will get back to you so that you can get an answer to your healthcare questions or needs. So again, it's all about being interactive. Or if you happen to be in the hospital for some reason and you have a question, just stop by my office. We can do that too.
Very nice. Well, there's so much to healthcare. It's hard to know
Yes.
everything. So it's like, you're out there, you got questions. If you're not into healthcare, they have questions. So it's nice to have somebody available who can tell you what's going on.
Well, and even us that are in healthcare, we have knowledge about certain things, but that's why it's a whole team. That's why we're made up of a lot of people that have a lot of different knowledge and expertise. So never be embarrassed by that. We all have questions, and better to ask the question and get the right answer than to fill in the blanks for yourself.
That's Theresa Rutherford. She's the new streamlined Theresa Rutherford.
Very nice.
Thank you very much.
You've been working hard, kid.
Yes, I have. Yes,
Good
I
for
have.
you. Good
Trying
for
to be
you.
healthier, trying to be a good role model for everybody.
It's always a good thing, no
That's
doubt about
right.
it.
She's the president and the CEO at HSHS, St. Anthony's Memorial Hospital, of the Southern Division of
That's right.
HSHS, and that's kind of cool because all these downstate and metro hospitals all working together to provide good care.
That's right. It's all about collaboration. Thank you very much.
Oh, thanks for being
Teresa.
here.
Appreciate Theresa Rutherford being our guest, and again, be listening over the noon hour today because more about the hospital activity coming up at 12:30 today. All right, community calendar for a Wednesday.